You fight the ultimate battle, right? You beat the cancer.
Exactly.
The chemotherapy is finally done. The radiation is over. The surgeon literally gives you the all clear. And everyone around you is just celebrating. They expect you to just, seamlessly bounce back to normal.
Yeah, but secretly, your body feels like it's been through this scorched earth campaign.
Right. And nobody warned you about the collateral damage left behind.
It is, it's one of the most frustrating disconnects in modern medicine, this very binary idea that you're either sick or you're completely cured. It completely ignores the physical reality of surviving a severe illness. Because the treatments we use to save a life often fundamentally alter the landscape of the body, sometimes permanently.
Which is exactly why today we are doing another custom-tailored deep dive into a part of that altered landscape, a part that rarely gets talked about openly, but man, it drastically affects everyday life.
It really does.
We are mapping out the non-hormonal treatments for vaginal laxity and dryness. And specifically, we're focusing on a group of women who desperately need these solutions, but are just, often left out of the conversation entirely. Breast and gynecologic cancer survivors.
While you are starving any rogue cancer cells, you are simultaneously starving the tissues of the urogenital tract. The vaginal mucosa, the surrounding connective tissues, the vascular network, they all rely heavily on estrogen to remain thick, elastic, and lubricated.
Right, so when you suddenly remove every single drop of estrogen from the system, the tissue just rapidly thins out, it dries up, and it loses its structural integrity.
It's essentially throwing the body into an accelerated, very intense form of menopause overnight.
Wow.
The clinical term for this is genitourinary syndrome of menopause, or GSM, and the symptoms are brutal. Severe vaginal dryness, burning, painful intimacy, and this feeling of looseness or laxity, because the tissue has entirely lost its balance and elasticity.
Okay, let's unpack this, because standard hormone replacement therapy is usually the magic bullet for these exact symptoms in natural menopause. But for cancer survivors,
It is almost universally off the table. You simply cannot give an estrogen-based cream or pill to someone whose specific type of cancer uses estrogen as fuel.
which leaves these patients navigating a very confusing and honestly often predatory world of alternative treatments.
Oh, absolutely.
Because when you are suffering from severe discomfort and your doctor tells you the standard cure is banned, you understandably start looking for literally anything that promises relief.
Right, you get desperate.
Exactly. So our goal today is to cut through that marketing noise. We are synthesizing a vast amount of clinical data here. We've got international regulatory guidelines from NICE, the FDA, and Australia's TGA, plus the latest trial protocols.
To give you a clear, evidence-based picture of what actually works and what doesn't, and, what might actually be dangerous when it comes to these non-hormonal options.
So where do we even begin?
To do that effectively, we have to start at the foundational level of what is structurally happening to the tissue. Before anyone even thinks about booking an appointment for a high-tech laser treatment, they need to look at the physical foundation of the pelvic floor.
Makes sense.
Because, surprisingly, the simplest, most conservative treatments are actually the medical gold standard.
And the foundational step recommended across all our sources is pelvic floor muscle training, or PFMT. Now, let's be incredibly clear about this. This is not just randomly squeezing your muscles at a red light.
Not at all. We are talking about targeted, supervised physiotherapy with a dedicated pelvic health specialist.
Right.
It involves structurally assessing the muscles, learning how to properly contract them to build support, and, crucially, learning how to fully relax them. Because a pelvic floor that is constantly clenched in pain just cannot function properly.
No, I have to push back on this a little bit.
Okay, go ahead.
Laxity, I understand. Laxity implies a loss of muscle tone and structural support. So going to the gym for your pelvic floor makes logical sense. But how in the world does flexing a muscle cure dryness?
That's a very common question.
Because if the cellular tissue is physically deprived of estrogen and completely parched, doing a workout doesn't seem like it would create moisture. Think about a dry, brittle kitchen sponge. If you squeeze a dry sponge in midair, it doesn't magically get wet, it just crumbles. Does squeezing this muscle actually draw water in?
I love that analogy. But we need to adjust the scenario slightly. Your dry sponge isn't floating in midair.
It's not.
No, it is sitting in a very shallow pool of water, which in the body is your vascular system.
Oh, okay, I'm tracking with you now.
Yeah, and recent clinical trials tracking the acute effects of PFMT on postmenopausal women actually measured this. They used an objective measurement tool. It's essentially a specialized moisture-detecting strip, adapted from tests they use for dry eyes.
Wow, to literally measure vaginal lubrication.
Exactly, before and after therapy.
Yeah.
And they found that a single session of supervised PFMT significantly reduced self-reported vaginal dryness.
Wait, really?
Yeah.
By doing what exactly?
By acting as a vascular pump. When you engage in targeted pelvic floor muscle training, you are dramatically forcing blood flow through the deep vascular network in the pelvis. That heavy rush of blood brings oxygen and vital nutrients directly to the starved tissue. It supports the health of the vaginal epithelium and encourages natural transudation.
Transudation.
Yeah, that's the fluid that naturally passes through the vaginal walls to create lubrication. So squeezing your sponge actually creates a pumping mechanism. It physically draws fresh, nutrient-rich fluid from the surrounding vessels into the parched tissue.
Which physically improves both moisture and elasticity. That completely changes the paradigm of physical therapy for me. It's not just about structural lifting, it's about cellular nourishment.
Precisely.
But realistically, even with the best blood flow in the world, if the tissue is severely thinned out, it often needs direct topical hydration, right?
Definitely.
And looking at the clinical assessments, the absolute superstar of non-hormonal moisture isn't some complex, expensive botanical oil. It's hyaluronic acid.
Yes. Hyaluronic acid, or HA, has effectively crossed over from facial skincare right into gynecological health. And the clinical data backing it up is highly robust.
I've definitely seen it in a lot of products.
But we need to make a crucial distinction about how it works compared to estrogen, because they operate on completely different biological principles. Estrogen works hormonally. It enters the body, binds to cellular receptors, and commands the cells to divide and thicken.
Whereas hyaluronic acid works purely structurally, it's basically a microscopic water magnet.
Exactly.
It's a molecule that can hold, what, up to 1,000 times its weight in water.
That's right.
So when it's applied topically, it binds massive amounts of moisture directly to the tissue, forming a physical protective gel barrier. It hydrates the area deeply and aids in natural tissue repair without ever touching a single hormone receptor.
Which is precisely what makes it incredibly safe and highly effective for breast cancer survivors. It creates this localized, hydrated environment where the fragile tissue can actually heal itself.
That's amazing.
But the application protocol is where people often get frustrated and quit. The clinical trials show that you can't just use it once a month and expect a miraculous cure. It requires a dedicated loading phase, followed by a strict maintenance phase.
The frequency matters enormously here. For women going through a standard natural menopause, using a high-quality HA gel maybe 1 to 2 times a week might be plenty to stay comfortable.
Yeah.
But for cancer survivors dealing with the severe sudden effects of aromatase inhibitors, the clinical data shows that a schedule of 3 to 5 times a week is required.
It's a big commitment.
It is. But when patients commit to that frequency, the trials show HA provides symptom relief that is actually comparable to low-dose vaginal estrogen for mild to moderate symptoms.
Think about that for a second. You rebuild the vascular support and pump fluid in from the inside with targeted physiotherapy.
Yeah.
And you rebuild the mucosal barrier from the outside with hyaluronic acid. For a patient who thought they had absolutely zero options, that combination is life-changing.
It is a massive win, but, and this is a big but, hydration and physio are fantastic for mild to moderate issues.
Yeah.
What happens when the tissue has thinned so much, when the structural proteins like collagen and elastin are so fundamentally depleted that those conservative therapies just aren't moving the needle?
That's the real challenge.
Here's where it gets really interesting. This is where energy-based devices enter the picture.
Yes. We are talking about the world of medical lasers.
Mm-hmm.
Specifically fractional CO2 lasers and erbium YAG lasers, as well as radiofrequency or RF therapies.
Okay.
These are technologies that have been utilized in dermatology for facial resurfacing and skin tightening for years, and now they are being heavily marketed as a solution for vaginal laxity and severe GSM.
I mean, the marketing makes it sound like a magic wand that just waves away the damage, but the actual biological mechanism is based on a concept called controlled thermal injury.
Correct.
Wait, if I have tissue that is already paper-thin and fragile from cancer treatments, shooting a high-powered laser at it to purposely injure it sounds like a terrible idea. Why are we purposely heating up this vulnerable area?
It sounds incredibly counterintuitive, I know. But it really comes down to how the human body naturally heals from microtrauma.
Okay.
Whether it's a laser pulsing precise columns of light or an RF device using electromagnetic waves, the goal is to deliver heat deep into the vaginal dermis. With radio frequency, for example, They are pushing the internal tissue temperature up to about 43 degrees Celsius.
That is warm.
Very warm. And when you heat the tissue to that specific threshold, you activate what are called heat shock proteins.
Heat shock proteins, okay.
This initiates a highly localized, deeply controlled inflammatory cascade. You are essentially tricking the body's fibroblasts. Those are the biological factories responsible for making connective tissue.
Tricking them into what?
Into thinking there is an urgent injury that needs immediate repair. In response, those fibroblasts wake up from their dormant state and start frantically producing brand new collagen and elastin fibers while simultaneously stimulating new blood vessel formation.
So it's exactly like doing a controlled burn in a dense forest, to clear out the dead brush and force new, healthy, vibrant growth.
That's a great way to picture it.
And to prove that this actually works on a structural level, researchers have run some fascinating animal models. There was a study we reviewed on swine vaginal walls, because apparently pig tissue is remarkably similar to human tissue in this regard.
Yes, it's a very standard model.
So they exposed this tissue to bipolar radiofrequency. They performed biopsies 4 weeks after the treatment, and the results were staggering. They literally saw a 52.8% rise in elastin concentration,
Which is huge.
and a 103.6% rise in collagen concentration in the treated areas. They doubled the amount of structural collagen in the vaginal wall.
The microscopic anatomy of the cells is undeniably changed by these energy devices. And the vital question is, well, does that microscopic change translate to actual physical relief for humans? Recent human trials, specifically tracking breast cancer survivors, set out to answer that. They compared the effects of CO2 lasers and radiofrequency against a topical treatment called promestrine, which is a synthetic low-absorption estrogen substitute used in some research settings.
And the conclusions were incredibly promising. The women receiving the energy device treatments reported significant symptom improvements that were completely comparable to the estrogen substitute.
Yes, exactly comparable.
They had dramatically better vaginal health index scores, a massive reduction in painful intimacy, and they reported feeling improved tissue elasticity and tone.
And crucially, in these highly controlled trials, there was no reported short-term structural tissue damage. The tissue didn't burn or scar. It thickened and remodeled itself healthily.
The short-term clinical data, particularly regarding the reduction of severe pain and the visible restoration of mucosal health, is undeniably encouraging. It proves the concept that we can trigger the body to rebuild its own degraded tissue without relying on systemic or even local hormones.
It does.
Okay, I have to stop you right there and ask the obvious question. If we have animal biopsies showing doubled collagen and human trials showing breast cancer survivors getting their quality of life back without using dangerous hormones, why isn't every single urogynecology clinic on Earth prescribing these lasers as the standard of care? Is this genuine revolutionary medical treatment? Or is this just cosmetic vaginal rejuvenation marketing preying on vulnerable women who are desperate for relief?
That is the multi-million-dollar question. And if we connect this to the bigger picture, the answer lies in the harsh, sometimes agonizing reality of medical regulation versus clinical enthusiasm.
Okay, explain that.
The biological mechanism makes sense. The short-term pilot studies look fantastic, but international regulators do not approve medical devices based on small pilot studies and pig biopsies.
Right, they need more.
They demand large-scale, long-term, sham-controlled, randomized clinical trials to prove both efficacy and, more importantly, safety over years, not just weeks.
And that is exactly where the heavy regulatory hitters come in, and the global pushback is severe. In the United States, the FDA issued massive, sweeping warnings regarding the deceptive marketing of these devices for vaginal rejuvenation.
They did.
They pointed directly to terrible adverse events recorded in their MIU database. That's the system that tracks medical device issues, citing reports of severe burns, aggressive internal scarring, and chronic debilitating pain.
Exactly. The science relies on controlled thermal injury. But when these high-powered devices are used outside of strict clinical protocols, or worse, used by practitioners in a med spa who aren't properly trained in complex pelvic floor anatomy, that controlled injury can instantly become an uncontrolled thermal injury.
And it's not just a cautious approach in the U.S. In the U.K., NST strictly classifies transvaginal laser treatment for urogenital atrophy and laxity as investigational. That means it belongs in research-only settings, not for routine clinical care. You shouldn't just be able to walk into a high-street cosmetic clinic and get this done on your lunch break.
No, absolutely not.
But Australia took it the furthest. In 2025, Australia's TGA, their equivalent of the FDA, went a massive step further and completely canceled all registrations for energy-based devices used for vaginal rejuvenation.
A total sweeping ban on the marketing and clinical use for those specific indications. Any device operating under those claims literally lost its legal standing to be used that way.
Wow.
Their reasoning was crystal clear. There is an unacceptable lack of long-term safety data. We know what the tissue looks like 4 weeks or 3 months post-treatment. It looks great.
Sure.
But what does a vaginal wall that has been repeatedly laced and heated look like 5 years from now? Does that newly formed collagen eventually stiffen and turn into rigid scar tissue? Does repeated thermal exposure impact the delicate pelvic nerves long-term?
That's terrifying to think about.
We simply do not have the high-quality long-term data to answer those critical questions yet.
So we have this agonizing tension. On one side, you have cancer survivors who are suffering right now, whose tissue is actively degrading today, and who see these pilot studies as a desperately needed beacon of hope.
Yeah.
On the other side, you have regulators pulling the emergency brake because the long-term safety isn't guaranteed, and bad actors in the cosmetic industry are causing real, irreversible harm. So what does this all mean?
It's a really difficult position for patients.
If someone is dealing with this right now and their oncologist just told them estrogen is permanently banned, what is the literal, actionable first step? How do they navigate this landscape safely?
It means you have to tune out the marketing billboards and follow a strict, evidence-based clinical pathway. You absolutely do not start with the laser. We can synthesize all of this data into a highly practical 3-step roadmap.
Okay, lay it out. Step 1.
Step 1. Always start with conservative care. You find a specialized pelvic health physiotherapist, and you really commit, to a supervised program of pelvic floor muscle training to rebuild that deep vascularization and muscle tone. Alongside that physical therapy, you implement a strict regimen of vaginal moisturizers. You specifically look for high-quality hyaluronic acid, and you use it 3 to 5 times a week to rebuild that mucosal barrier from the outside.
And for intimacy, the sources highlight using generous amounts of osmolality-balanced lubricants?
Yes, osmolality is a critical point there. Osmolality basically means how much stuff, like salt and sugars, is dissolved in the liquid.
Okay.
If a lubricant has a higher osmolality than your own cellular tissue, it literally sucks water out of your cells to balance itself out. It makes you feel wet in the moment, but it actively dehydrates your tissue in the long run.
Wow, that is so counterproductive.
Extremely. So you must use products explicitly balanced to match your body's natural chemistry. That combination alone, the physio, the hyaluronic acid, the smart lubricants, that will resolve or significantly manage symptoms for a vast majority of women.
But if symptoms persist after truly committing to that regimen, you move to step 2, which is diagnostic. You must ensure that the physical feeling of laxity or looseness isn't actually a misdiagnosed pelvic organ prolapse or a rigid perineal scar issue from a previous trauma.
This is a vital safety check. If the structural ligaments of the pelvis have fundamentally failed and an organ is physically pressing down into the vaginal canal, no amount of laser-induced collagen is going to pull that organ back up.
Exactly.
That requires completely different medical interventions, potentially including surgery or supportive pessaries. You need a proper anatomical assessment by a qualified urogynecologist, not a consultation at a cosmetic med spa.
Which brings us to step 3. Only if a thorough trial of conservative care completely fails and structural mechanical issues like prolapse have been definitively ruled out should a patient even begin to consider energy-based devices.
Yes.
And based on global guidelines from the FDA and NICE, ideally this should only be done within the safety, oversight, and strict protocols of an official clinical trial.
If you are going to explore lasers or radiofrequency, you want it done by a medical specialist who is meticulously tracking your long-term outcomes. Not someone trying to upsell you on a package of aesthetic treatments.
Right.
The clinical trials are actively ongoing because the medical community genuinely recognizes the urgent need for non-hormonal options for cancer survivors. The technology is incredibly promising, but we have to respect the scientific process to ensure we aren't trading a short-term fix for a long-term complication.
It is a delicate, often frustrating balance. But the overarching message here is that while breast cancer treatments and the sudden severe estrogen drops they cause can fundamentally alter your physical landscape, you are absolutely not out of options.
Definitely not.
The non-hormonal toolkit is growing rapidly. We understand the cellular mechanisms of hydration better than ever. Physical therapy is proving to have measurable vascular benefits, and science is actively searching for ways to restore tissue function safely.
You know, this entire deep dive raises a fascinating question, though. And it's something that echoed through almost all the research we reviewed today.
What's that?
Throughout these international trials, vaginal laxity is repeatedly described as a poorly understood condition that is mostly measured subjectively. We rely heavily on patient questionnaires, asking women how they feel on a scale of 1 to 10, rather than objective clinical tools.
Which makes standardizing any of these treatments incredibly difficult. How do you prescribe a standard cure for something you can't universally measure?
Exactly. Think about how we treat bone health. We don't wait for a woman to break her hip to guess her bone density. We use a DXA scan.
Right.
If the medical community can develop objective, universal diagnostic tools to accurately measure vaginal microtrauma, blood flow, and tissue elasticity in real time, it changes the entire paradigm of women's health.
That is a phenomenal thought, because if we could see the microtrauma with the clarity of an X-ray, we wouldn't have to wait for the scorched earth to appear.
We could detect the very early stages of structural degradation and intervene.
We could protect the physical landscape while the battle against the cancer is still being fought, rather than just scrambling to treat the severe atrophy after the fact.
It's a hopeful, entirely possible vision for the future of survivorship.
It really is. Thank you for joining us on this deep dive. Keep questioning the marketing, keep learning the science behind your own physiology, and most importantly, take this information with you into your next doctor's appointment. You are your own best advocate.